We are the cardiac
glycosides.
glycosides.
My generic names are digoxin with the brand names of lanoxin and lanoxicap, digitoxin with the brand name of histidogin, and dislanoside with the brand name of sidilanid D. My chemical names cardiac glycoside, that is digitoxin beta hydroxylated at C12.
We are classified according to our therapeutic and pharmacologic effect. Therapeutically, we are classified as an antiarrhythmic or an inotropic drug. We are also classified pharmacologically by our aglycons, which can be divided into two chemical groups, the cardenolides and the bufadinolides, with the former group being the most implicated in cardioactivity. Studies in animals or humans demonstrate fetal abnormalities or adverse reaction reports indicate evidence of fetal risk. The risk of use in pregnant women clearly outweighs any possible benefits, which leads us to be categorized as pregnancy category X. So, we will discuss about how we affect in the human body.
What do body do to us?
What are we used for?
Contraindications.
Our unintended effects that predictably will cause undesirable responses.
What do nerves do to us?
Our mechanism of action. We are potent inhibitors of cellular sodium-potassium ATPase, which cause intracellular sodium concentration to increase. This then leads to an accumulation of intracellular calcium via the sodium-calcium exchange system. In the heart, increased intracellular calcium causes more calcium to be released by the sarcoplasmic reticulum, thereby making more calcium available to bind to troponin C, which increases contractility or the inotropy. Our parasympathomimetic action reduces sinoatrial firing rate or decreases heart rate or the negative chronotropy and reduces conduction velocity of electrical impulses through the atrioventricular node or the negative drumotropy.
Pharmacokinetics. I am absorbed orally and my absorption varies from 0 to nearly 100%. I am distributed widely to tissues including the central nervous system. I am not extensively metabolized in humans and almost 2/3 of me is excreted and changed by the kidneys. My renal clearance is proportional to creatinine clearance and my half-life is 36 to 40 hours in you patients with normal renal function.
What are we used for or our indications? We are used typically in the therapy of atrial fibrillation and congestive heart failure. We also enhance myocardial contractility, probably by increasing levels of myocardial cytosolic because of inhibition of sodium-potassium ATPase. We are now reserved largely for patients with left ventricular systolic dysfunction and atrial fibrillation, or for patients with congestive heart failure in sinus rhythm and residual symptoms despite maximal alternative therapy. It is usually along with other medications.
I am contraindicated to patients who are allergic to any component of digitalis preparation, patients with ventricular tachycardia or fibrillation, patients with heart block or the sixth sinus syndrome, patients with idiopathic hypertrophic subaortic stenosis, and patients with acute myocardial infarction.
The side and adverse effects in the different body systems. Let us first discuss about the side effects. Firstly, the cardiovascular system. We can cause cardiac arrhythmias, atrial tachycardia, heart block, and sudden cardiac death. In the gastrointestinal tract, we can cause nausea, vomiting, anorexia, diarrhea, and loss of appetite. In the integumentary system, we can cause red bumpy rash. In other body systems, we can cause dizziness and mental disturbances. We will then discuss about our adverse effects. Again, in the cardiovascular system, we can cause ventricular and atrial arrhythmias, atrioventricular block, and sinus bradycardia. In the gastrointestinal tract, we can cause anorexia, nausea, vomiting, abdominal pain due to gastric irritation, mesenteric vasoconstriction, and CTZ stimulation. In the central nervous system, we can cause headache, mental confusion, disorientation, psychosis, lassitude, confusion, delirium, and psychotic behavior may appear. In the integumentary system, we can cause skin rashes and gynecomastia. In other body system, we can cause skin rashes and gynecomastia, fatigue, malaise, headache, restlessness, hypernoia, and visual disturbances.
If you were a nurse, you should be aware of these responsibilities before, during, and after administering me to your patient. So before my administration, there are important things that you nurses should include in conducting assessment, history taking, and examination. First, assess your patient for contraindications that I mentioned earlier to prevent potential adverse effects. Conduct thorough physical assessment before beginning my therapy to establish baseline status, determine my therapy effectivity, and evaluate my potential adverse effects. Obtain baseline status for weight while noting recent manifestations that increase or decreases to determine your patient's fluid status. Assess closely patient's heart rate and blood pressure to identify cardiovascular changes that may warrant a change in my drug dose. Auscultate heart sounds to note the presence of abnormal sounds and possible conduction problems. And determine urinary pattern and output to assess gross indication of renal function. Take the patient's apical pulse first for 1 minute before administering me. So if the patient's apical pulse is less than 60, my dose should be withheld and have your prescribing provider notified. Check my dosage and preparation carefully. Avoid eye injections, which may be very painful. Follow diluting instructions carefully and use diluted solution promptly. Avoid giving meals to your patient because this will delay my absorption. My serum level should be monitored with a normal therapeutic range from 0.8 to 2 nanogram per milliliter. Monitor your patient for my signs of toxicity and have emergency equipment ready. Have potassium salts, lidocaine, phenytoin, atropine, and cardiac monitor readily available in case toxicity develops. After my administration, monitor your patient's response to my therapy through assessing manifestations of heart failure, arrhythmia, and my serum level. Monitor your patients for my adverse effects. Evaluate your patient's understanding on my therapy by asking patients to name me, my indication, and my adverse effects to watch for. And monitor your patient's compliance to my therapy.